Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Lagos State government halts reopening of churches and mosques as state records rising cases of coronavirus. Imo State House of Assembly shuts down for 2 weeks as a lawmaker tests positive for COVID-19. And UK scientists say new drug shows promise of treating patients seriously ill with coronavirus. Nigeria tops the West African region with the total infections at 16,658, followed by Ghana in second place with 11,964 cases. And you have Côte d'Ivoire in third place with 5,439 confirmed cases of COVID-19. According to the Nigeria Center for Disease Control, NCDC, 5,349 patients have recovered and 424 deaths have been recorded. Regional representation of the figures leaves Lagos State with cases at 7,319, followed by the FCT in the North Central region with 1,264 cases. Kano leads in the Northwest with 1,158 cases, and we have Edo leading in the South-South with 620 cases. Borno in the northeast has 439 cases, the highest in the region, and Abia State still leads in the southeast with 173 cases. Now, those who were warming up to attend churches and mosques this weekend may have to wait a little bit longer, as Lagos State Governor today put on hold earlier decision to reopen the churches and mosques on Friday 19th June and Sunday 21st June 2020, respectively. Briefing the State House correspondents today, Governor Babajide Sanwo-Olu said the decision became necessary due to the increase in the number of coronavirus cases in the state.
Labs, which will probably bring it to a total of about 11 or 12. But we have 5 that are active now. And on a daily basis, we're doing over 1,000 tests, which is why we're seeing the amount of positivity that is occurring in the state. However, like we've also rightly expressed before, the uplifting news is always that we know that about 85 to 90% of all of these cases present themselves as mild to moderate cases. That is what the trend and the picture and the analysis is still showing. It's still the 10% or thereabouts that goes into severe to critical stages. And we're seeing in that space a lot of respiratory issues within that percentage. And so there are Lagosians. In the most recent guidelines issued on the gradual easing of lockdown, following the advice of the Presidential Task Force, I noted that we would shortly be permitting restriction on religious houses on the condition of strict compliance with the detailed guidelines issued earlier by the State Safety Commission. We have had to, over the last week and a half, have to continue to monitor the trend, have to continue to study the level of preparedness and level of engagement that we've had with these stakeholders. And I want to inform you that we will not be proceeding with the opening of the places of worship as been said earlier for the 19th and 21st. We will be suspending it until further notice.
the Lagos State Governor with steps to curtailing COVID-19 in the state. Well, you can see the Channels TV COVID-19 case monitoring dashboard tells the story of the national coronavirus figures across the country. The dashboard displays the ongoing COVID-19 outbreak in 35 states and the FCT. Of course, our health correspondent, Yomi Otagbe, is with us here.
Hello, Millicent. Good to be here again.
Indeed. So we're seeing a record increase of cases so far, and indeed, this is also, we're looking at government's efforts to indeed reducing the spread. But for you, across the states, we've seen a jump in 2 states, and that's because a lot of more testing is taking place.
Okay, a lot of more testing is taking place. So if we look back a month ago, we had about 39,000 tests done. Now we have over 90,000, so that is more testing. But for me, it's not just about the testing. It's about the fact that when you test, if there's nothing to find, then you won't find. So finding the cases means that there's the story of active community transmission that is going on in Nigeria. And the figures, will tell you all of the stories. We have over 16,000 confirmed cases now. If you look back just a month ago, for instance, that's today, these figures are for June 15th. So look back at May 15th. Lagos State had just about 2,000 cases. Today, Lagos State has over 7,000 cases. So it tells you, and as the governor said, this is the reason why, some of the decisions taken, they are, stepping back on them and saying, you know what, the cases are rising and we can't continue to say, okay, things should return to normal.
But interesting to note that, as much as we're seeing the rises in cases, a lot of people want us to get to our peak. Perhaps that's, will take us to things coming back to normal.
The only state that I've heard, talk about, a time frame for the peak is Edo State. Edo State, I think the governor was talking about June 28th or thereabout. But for Nigeria, we are still looking. The Minister of Health has said we are not at our peak yet. And so if we are not at our peak yet and we have all of this, figures coming in, then it means every one of us, we have a responsibility to take this response in our own hands.
My fears now is that Lagos has 20 collection centers, over 5 testing labs. It has more population, but if we put that kind of effort across states, we're seeing FCT, Kano,
So let's talk about the story of Edo and River State, for instance. So between April 15 and May 15 and then June 15. So River State moved from just 2 cases, April 15th, to 33 in, you can just scroll up, let's just see what we have, the figures. So we have to 33 on May 15th, and by June 15th, you can see the figures. So I think it speaks a lot of, volumes that what are, or how are the people taking this response? Because if you believe this is not true, yesterday we had about, unfortunately, another senator, lost to this disease. So this is real, and it is something that all of us, we must take this collective responsibility.
All right, thank you, Yomi Otagbe, for the latest on the Channels Television COVID-19 case monitoring dashboard.
Thank you.
Now, Imo State House of Assembly has been shut down for the next 2 weeks following the announcement that a lawmaker tested positive to COVID-19. The chairman of the COVID-19 task force in the state, Professor Morrissey, will disclose this while briefing newsmen in Owerri, the state capital. He said the samples of all other lawmakers and their aides have been taken for testing to be able to ascertain the number of people who might have come in contact with the lawmaker who tested positive. He added that the assembly complex has been shut down to enable proper contact tracing and isolation.
The House of Assembly is shut for 2 weeks to enable us to fumigate the place and also to allow the members to be on self-isolation or observation until we know whether they are positive or negative. Like we said earlier, we are following a laid-out strategic plan based on recognizing that this COVID-19 is not only a health emergency, but it's also a social emergency so that while we are trying to make sure that we take care of the public health crisis, we also do everything we can to prevent a breakdown of the social order or be able to maintain the social harmony. So social harmony is very important in the strategic plan that we have in tackling this epidemic or this pandemic now.
For the governor of Ebonyi State, dealing with the spike in the coronavirus case implies more attention has to be on asymptomatic carriers. Governor Ebonyi says that the government is fighting hard to test more and protect vulnerable persons in the state. He spoke during the commissioning of a 150-bed general hospital to function as a standard infectious treatment center in Abakaliki, the state capital.
The number of cases you report is as a result of the number of testing that you are doing. And for any state that is not doing extensive testing, you are not doing good for your citizens. Because this COVID, from experience, we've seen that a healthy man or woman could have it and they could go through it and nothing. They will not show symptoms, will not be down. But in the process, it can spread the virus to a weaker man or woman.
COVID-19 isn't just a public health issue, but also an economic and political one. As we learn to live with the disease for some time, how do we get used to new arrangements in our daily lives? How prepared should we be for a different future? Mrs. Biola Ajenifuja is a clinical pharmacist, chief pharmacist with Gwarinpa General Hospital, the FCTA, Abuja. She joins us from our Abuja studios. Welcome to the program. First, let me begin by asking what your reaction is to the Lagos State government going back on its earlier announcement to open worship houses.
Yeah, it's a welcome development which is coming at the rightest time, if there's such word. Because if we look at the epic curve, it's not flattening. Rather, we're having more cases. So it's better the religious center remain closed for now while we tackle the issue of the rising cases of COVID-19. Then when we get to the flattening of the curve, then we can start thinking of reopening the worship centers. So it is coming at the right time to me.
Another issue fueling community transmission, we understand, is interstate travels, and there's been mixed levels of compliance across the country and also compliance to the precautionary measures. When you look at states and their efforts so far responding to the COVID-19 pandemic, how would you say they're doing?
Yeah, I think the security agencies need to tighten their grip more on the interstate ban, because there are still people moving in and out of states. And this is evident by, I have people close to me that have been somewhere, been to other states. So it means that the ban is not really very effective. So more needs to be done to ban the interstate movement so that we can contain this. Because some people are asymptomatic, so moving to other states, they tend to go and spread it in the other state. But when you remain where you are, it's easy to contain. So I think we need to do more on the interstate ban to reduce the significant high cases that we are recording now. So they need to tighten the grip more on interstate movement.
So, Mrs. Ajenifuja, we're having Lagos doing a turnaround, saying, okay, halt churches, worship centers for now. Do you see the federal government taking a step back again, saying as some of the measures they put in place aren't really as strong or working?
I think they will need to really assess the situation. Need to look at the worship centers that have been opened. Are they complying with the guidelines? Are all the precautionary measures put in place? Then we need to look at the figures in FCT. Though the figures are erratic, not really following a particular pattern, you see cases today, less cases tomorrow, then high cases. So it's not really following a straight pattern. So I think we need to reassess the situation to look at the worship centers to see if they are complying with these guidelines. And if they are complying with it, then we need to sit down back and see if we should continue in that line or if we need to increase more precautionary measures in these worship centers for us to reduce these cases of COVID-19.
All right, Mrs. Biola Ajenifuja, clinical pharmacist, Gwarinpa General Hospital, Abuja. Thank you for joining us on the program.
Thank you very much.
Let's take you to Abuja, where we have Dr. Chuk Sironkwe. He's a medical laboratory scientist. He joins us from Abuja studios. Welcome to the program. Doctor, Nigeria is experiencing more infections from COVID-19, and we understand that week on week in testing is increasing, nearing 100,000 the samples tested across the country. But what more can we do to ramp up testing, since we've been told that as much people as we test, we get closer to our peak and closer to curbing the virus?
Yeah, thank you for having me. It is true that NCDC has really improved on the number of testing. But it's not just about testing. Quite a lot needs to be done while you test. Even as I speak to you, I want to say that the testing within the community is we've not still had enough. By the time you get to a community, you discover that very few people come out for testing. So as regards to testing, Nigeria, the NCDC needs to do more as to the number of people they test per community. And that is the only way you can get the true numbers. The numbers we are getting now, I'm sorry to say, may not represent truly what we truly have. And it goes to show that we are only breeding or incubating people within communities who would definitely, at the end of the day, transmit this virus to those who are vulnerable. And that is the danger we may be facing as a country.
You say testing should increase community level. So paint a picture of what you expect in terms of sample collection centers. How much should we have in each community amongst these 774 local government areas?
Yes, I expect engagement, and what is missing between those who are collecting the sample, the NCDC who is organizing sample collection and testing, is communication. Most times when you get to the community, you discover that there is a communication gap. People don't seem to understand why they should submit themselves for testing. And it is key also to note here that while you test, it is important for you to present alongside the palliatives. It's a strategy I felt the government didn't really do well. Of course, we had a lockdown, and during this lockdown, it is expected that people would be tested and you are handed over palliatives. But those who are testing currently on ground will tell you that the major complaint is that most people really come out to look out for palliatives before they submit themselves for testing. And we have not seen that synergy between distribution of palliatives and the actual collection of samples. So that, of course, have reduced the numbers, and there's need to do something about it.
The Presidential Task Force has said that states need to own the fight to curbing the pandemic. So they have a role to play. But in your assessment, what do you make of some of their approaches to curbing COVID-19?
First, I would want to say that states should not respond to panic. We are seeing a lot of panic response, and that is a major factor affecting the whole exercise. And of course, states also should be responsible and keep to their words as to payments of the frontline health workers. And there should be confidence that by the time I'm submitting myself, as a frontline worker, I should get my pay at the end of the day. But we are not seeing this in the various states. So there is a break in the synergy between field workers and their employers. And I want to call on states to live up to expectation and pay to those who are actually doing this work. And most of them, we have gathered that they go to their various houses at the end of the day, and that is not supposed to be. Those who have contacted the virus are in isolation centers, have been promised to get certain allowances. We understand also they have not been paid. And this goes a long way to show that there's no trust between those actually doing the collection, doing the testing, and their employees. So also, the communities would not want to submit themselves to this testing. And when you get there, you discover very few people would come out to submit themselves for testing, and that is not good enough. And I want to tell you that about 50% of the population in the various communities come out to be positive. And this is not good. It shows that we are only having breeding grounds for people who will transmit this virus to those who are vulnerable. And those who are vulnerable at the end of the day will have to bear the brunt of this deadly virus.
We'd like to thank you for lending your voice to this important issue. Dr. Chuks Ronkwe, medical laboratory scientist, joining us from Abuja. Thank you. Scientists may have made a breakthrough in the treatment of the coronavirus, given rave reviews of dexamethasone, a type of corticosteroid medication used in the treatment of many conditions, including rheumatic problems, skin diseases, severe allergies, and others. Now, those in the UK where the drug is being tried said it cut the risk of death by a third for patients on ventilators, and for those on oxygen, it cut the death by a fifth. This is as global figures continue to rise above 8 million. That's according to the Johns Hopkins COVID-19 Resource Center.
Italian cinemas have begun to gradually open as the city continues to ease lockdown restrictions. Of course, this comes with new safety rules, including leaving 2 empty seats next to each spectator and compulsory face masks. Italy has recorded 237,290 cases of coronavirus and 34,371 deaths, but continues to lift restrictions gradually. Over in Germany, the public is being encouraged to download a smartphone app setting to subdue the outbreak of new coronavirus infections. It does so by using Bluetooth to monitor close contact between people and issues a warning if one of them is positive. Public enthusiasm for the app is moderate as the country's cases reach 188,213 and death toll climbs to 8,856. Residents in Moscow are budding with excitement as museums and summer terraces are open for the first time in 2 months as the Russian capital rolls back coronavirus curbs. Despite continuing to record over 1,000 daily new infections, the capital city continues to roll back curbs. Moscow, which was hit the hardest by the pandemic within Russia, has recorded 208,680 cases and 3,386 deaths. Algeria's streets are filling up as the government relaxes lockdown restrictions with strict precautionary measures in place. After nearly 3 months of lockdown, taxi drivers can now take one client at a time. But the metro remains closed, leaving some unable to get to work. The North African country has 10,810 cases and 760 deaths.
The Nigeria Center for Disease Control's website is live. It continues to work closely with states, training health workers to manage COVID-19 patients to recovery. It's asking everyone to take responsibility to protect yourselves. You can find the latest national strategy and other advisories. Also, the World Health Organization has the latest updates on the global response to COVID-19. It is updating practical guidance for strategic action tailored to local context. You can take a closer look at some of the numbers in real time. Our website, channelstv.com, has more updates on the pandemic in Nigeria across the world, plus other stories. All you need to do is log on to channelstv.com. We have another update at 9 p.m. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.